Over 70? 6 medical tests you don't actually need, and what to do. Instead, most people think medical tests are always a good idea, but what if I told you that after a certain age, some of them could actually put your health, and even your life, at risk? It sounds strange, I know, but the truth is, not all screenings and checkups are harmless. In fact, some of the most common tests offered to older adults may lead to false alarms, unnecessary stress, and dangerous procedures. That's not fear-mongering. It's something more and more doctors are beginning to acknowledge, especially when working with patients over 70. The medical world is waking up to a new reality. One-size-fits-all testing can do more harm than good as we age. In this video, we're going to take a close, honest look at 6 specific medical tests that seniors are often better off skipping. Screenings that even experienced doctors often turn down for themselves. We'll explore why these tests are so commonly recommended, the hidden dangers they carry, and the safer, smarter alternatives that keep you informed without putting you at unnecessary risk. You deserve medical care that respects your age, your body, and your quality of life. If you're someone who cares deeply about your health but also wants to avoid being overtreated, overmedicated, or overwhelmed by today's healthcare system, this video is for you. We're not here to scare you. We're here to empower you with knowledge, confidence, and a clearer picture of what truly supports your health after 70. Let's begin. Number 1. The colonoscopy. Trap colonoscopy has long been considered the gold standard for preventing colon cancer. But after age 70, especially in people without symptoms or family history, this test can quietly become more harmful than helpful. What was once a life-saving screening in your 50s or 60s can, past a certain point, turn into a source of unnecessary risk, stress, and even hospitalization. Why? Because the procedure itself is no small matter. It involves full bowel prep, sedation, and the insertion of a scope deep into your intestines. That's taxing enough for a younger adult, but for older adults, the risks go up significantly. The bowel cleansing process alone can cause severe dehydration and electrolyte imbalances, both dangerous in seniors. And sedatives used during the procedure can linger longer in an older body, leading to confusion, dizziness, and a higher risk of falls. But there's something even more concerning. Many older adults, especially over 75, are subjected to follow-up surgeries or treatments after a colonoscopy finds small polyps. Polyps that may never have caused harm in the first place. These slow-growing abnormalities often take 10 to 15 years to develop into anything serious, and for someone in their 70s or 80s, those years may never come into play. Yet the discovery creates fear, triggering a chain of biopsies, repeat scopes, even partial bowel removals, all in the name of prevention. But when the risks of these interventions outweigh the benefits, prevention becomes harm. Here's an example I'll never forget. A friend of mine named George, 82 years old, active and sharp as a tack, was talked into getting a routine colonoscopy, even though he had no digestive issues. During the prep, he became severely dehydrated. After the procedure, he was groggy and confused, fell at home that night, and fractured his hip. That one test led to months of rehab, medical bills, and stress. And guess what? The scope found nothing. This isn't about blaming doctors. They're doing what they were trained to do. But medicine is evolving, and we have to evolve with it. If you're over 70 and not experiencing symptoms, it's perfectly reasonable to say no to a colonoscopy. There are non-invasive stool tests now that are safer, easier, and effective for many. It's about weighing the true cost, physically, emotionally, and financially, of putting your body through something that may not actually help. We must stop assuming more testing always equals better care, because after 70, better care often means fewer interventions and more thoughtful choices. You're not neglecting your health by being cautious. You're honoring it. Number 2. The annual full body scan mistake. There's something seductive about the idea of a full body scan. Having a machine look through you from head to toe, Uncovering every hidden issue before it becomes a problem sounds like smart prevention, right? But for seniors over 70, this approach can be more of a curse than a blessing. While the intention behind full body scans may seem proactive, the outcomes often set off a domino effect of fear, invasive tests, and even unnecessary surgeries that can shorten your life, not lengthen it. Let's be clear. Full-body CT scans and MRIs aren't your typical screening tools. These powerful machines pick up everything, including harmless abnormalities that would never affect your health or lifespan. These so-called incidental findings can turn into ticking time bombs in your mind. A small nodule here, a shadow there, and suddenly you're on the merry-go-round of follow-ups, biopsies, and specialists chasing something that might never have mattered. Why does this matter more after 70? Because the older body doesn't respond the way it used to. A biopsy that would have been simple at 45 can now lead to a collapsed lung, an infection, or weeks of recovery. Even something as routine as lying still for an MRI can be physically exhausting or painful for older joints. And the emotional toll is enormous. Seniors often carry the burden of worrying about what might be, rather than enjoying the health they actually have. Take the case of Betty, a 78-year-old woman I met during a senior health seminar. She was vibrant, walked every day, and had no complaints. But during a health fair, a mobile clinic offered her a discounted full-body scan. They found a tiny lesion on her kidney, so small it hadn't caused any issues and likely never would. But the word lesion ignited panic. Within a month, she was in surgery. The aftermath. Months of recovery, a drop in energy, and lingering complications that never quite went away. All for something that might have remained silent forever. Medically, it's called overdiagnosis. Emotionally, it's called unnecessary fear. Financially, it's draining. Full-body scans are rarely covered by insurance. Unless there's a clear reason, many seniors end up paying out of pocket, thinking they're buying peace of mind. But what they're really buying is a ticket into a system that may never stop testing. Responsibility in this chapter of life looks different. It means trusting your body a little more, listening to how you feel, not just what machines say, and recognizing that not every shadow on a screen deserves your energy or your fear. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3, bone density scans. When you're low risk, bone density scans, or DXA scans, are often recommended to check for osteoporosis. They sound harmless, just a quick scan to check your bones, right? But for many people over 70, especially those without risk factors, routine scans can lead to overdiagnosis and unnecessary treatments. Here's why. As we age, bone thinning is normal. A scan might show osteopenia, a fancy word for mild bone loss. But mild bone loss doesn't always mean you'll break a hip. Yet doctors may rush to prescribe medications like bisphosphonates, which come with side effects, from severe bone pain to digestive issues, to, ironically, rare fractures of the thigh bone. Take Nancy, age 75. She had no history of fractures, walked daily, ate well, and had good balance. A routine bone density scan showed mild osteopenia. Her doctor prescribed medication, just in case. Within months, Nancy developed severe joint pain and acid reflux. She stopped exercising out of fear, and her quality of life declined. Better approach? If you're over 70, healthy, and have no prior fractures or risk factors, ask your doctor whether you truly need a bone density scan. Focus instead on balance exercises, strength training, and sufficient calcium and vitamin D. Those strategies reduce fall risk, which is the real danger for seniors. Number 4, PSA tests for prostate cancer. Many men over 70 continue to have annual PSA blood tests to screen for prostate cancer. But studies show that after a certain age, these tests often cause more harm than benefit. Why? Because PSA levels naturally rise with age. A slightly elevated PSA might trigger biopsies, MRIs, or even surgery for slow-growing cancers that may never cause symptoms or shorten your life. Take the case of Jim, age 76. His PSA crept slightly above the normal range. Doctors ordered a biopsy, which caused bleeding and infection. He ended up hospitalized for 2 weeks, all for a cancer so small and slow-growing it might never have bothered him. Major health organizations, including the U.S. Preventive Services Task Force, recommend against routine PSA testing for men over 70 unless you have symptoms. Instead, discuss your personal risk factors and life expectancy with your doctor before deciding on screening. Number 5. Routine cardiac stress tests. There's something about heart disease that makes it feel like a ticking time bomb. You hear stories of someone who seemed healthy one day and then suddenly collapsed the next. So, it's only natural to want to catch any issues early. That's why cardiac stress tests, those treadmill or chemical tests that monitor your heart's response under pressure, have become so common, especially among people over 70. But here's the surprising truth. For many seniors, especially those without any cardiac symptoms, these tests do more harm than good. The idea behind a stress test sounds reassuring. You walk on a treadmill, they track your heartbeat, and if something looks off, they take action. But the reality is more complicated. Most people over 70 already have age-related changes in their cardiovascular system. Mild stiffness in the arteries, a little plaque here and there, slower recovery after exertion. These are often normal signs of aging, but when they show up on a stress test, doctors may interpret them as red flags, prompting further testing and even unnecessary procedures like angiograms or stent insertions. That's where things get risky. Those follow-up procedures aren't without consequences. Catheterizations can lead to bleeding, stroke, or kidney damage, especially in older adults with fragile blood vessels and reduced kidney function. Take Harold, a 76-year-old grandfather from Illinois. He was feeling fine, walking daily, playing with his grandkids, no chest pain or shortness of breath. At his annual checkup, his doctor suggested a stress test, just to be sure. The test showed a minor abnormality. That led to a catheterization, revealing some non-obstructive plaque. Doctors placed a stent anyway. Harold developed complications from blood thinners, landed in the hospital with internal bleeding, and spent the next 3 months recovering, all from a test he didn't need. So why does this happen? Part of it is fear of missing something. But at this stage of life, it's important to focus on quality over quantity, preserving energy, independence, and comfort, rather than chasing problems that haven't even shown up. Many respected cardiologists now advise against routine stress testing in older adults who don't have symptoms. The evidence just isn't strong enough to support it. Instead, the smarter path is symptom-based care. If you're having chest discomfort, unexplained fatigue, or shortness of breath, then yes, evaluation makes sense. But if you're feeling steady, sleeping well, and staying active, your body may be telling you more than any machine can. Number 6. Routine thyroid ultrasounds. Thyroid ultrasounds have become increasingly popular in older adults, even without symptoms. But here's the catch. They often detect tiny nodules that are harmless. In seniors, the chance that a tiny thyroid nodule will turn into dangerous cancer is very low. Yet finding it triggers biopsies, anxiety, and sometimes surgeries that carry real risks, including damage to nerves that control your voice or your ability to swallow. Let's talk about Barbara, age 79. She felt perfectly well. A routine ultrasound showed a tiny thyroid nodule. Doctors insisted on a biopsy. The biopsy caused bleeding and a painful swelling in her neck. She ended up in the hospital for observation, all for a nodule that wasn't cancerous and likely never would have been. Major endocrine societies advise against routine thyroid ultrasounds in people without symptoms. Unless your doctor feels a suspicious lump, or you have symptoms like unexplained weight loss, or trouble swallowing, it's usually best to skip this test. Final thoughts. Growing older doesn't mean growing helpless. If anything, it's the time in life when we're finally wise enough to question the system, to slow down and ask, is this really for me? In a world that glorifies more checkups, more screenings, more pills, sometimes the bravest choice is doing less. Not out of neglect, but out of deep understanding, out of knowing your body, your values, and your goals. At this stage of life, healthcare in your 70s and beyond shouldn't be a conveyor belt of automatic tests and impersonal routines. It should be a conversation about what matters to you, how you want to live, and what risks you're truly willing to take. Blindly following protocols designed for younger bodies can rob you of energy, peace of mind, and even years off your life. Not because doctors mean harm, but because they're trained in a system that often chases disease instead of honoring health. If this video made you think twice, if it gave you a new lens to see your health through, then it's already done its job. And remember, saying no to certain tests doesn't mean you're ignoring your health. It means you're being deliberate. You're weighing the benefit against the burden. You're recognizing that not every test leads to clarity. Some lead straight into the maze of overdiagnosis, anxiety, and unnecessary treatment. So, take ownership. Talk openly with your doctor. Ask whether the test is likely to change the outcome or just the paperwork. Think about your time, your energy, and your comfort, because at this age, those are precious. You've earned the right to live on your terms, not fearfully, but thoughtfully. Not overloaded with procedures, but empowered with knowledge. And not constantly preparing for sickness, but actively creating a life of meaning, joy, and connection. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.